Have you ever wondered what one of the most daunting decisions a teenager might face is? In our complex world, young people grapple with numerous challenges, and among the most significant is the consideration of an abortion. This video intends to illuminate the inherent perils of teenage abortion, its underlying causes, alternative avenues, and possible remedies. Regrettably, teenage pregnancies are a stark reality, often resulting from a lack of education, limited access to contraception, or simply being unprepared for the responsibilities associated with sexual activity. This leads to an unfortunate situation where abortion seems like a solution for some teens. However, it's crucial to understand that abortion, especially during teenage years, carries significant risks. The physical and psychological implications are far-reaching and can have lasting impacts on these young lives. Regrettably, some teenagers see abortion as a solution to an unplanned pregnancy. But is it really a solution, or does it merely pave the way for a host of other problems? Medical professionals warn of the inherent dangers of teenage abortion. With bodies still in crucial stages of development, teenagers face an increased risk of complications from abortion procedures. Doctors, nurses, and surgeons often report cases of severe bleeding, infection, and even perforation of the uterus in teenage patients. These complications are not only painful and distressing, but can also lead to hospitalization and lasting damage to the reproductive system. Let's hear directly from the experts. Dr. Jane Patterson, a renowned gynecologist, shares, "The physical risks of abortion for teenagers are unfortunately quite high. Their bodies are still maturing, which can make the procedure more traumatic and increase the likelihood of complications. These can range from infection and excessive bleeding to more serious issues like damage to the uterus." Indeed, these are not just theoretical risks. Many young women have experienced these complications firsthand. Consider the story of Emily, a teenager who underwent an abortion. She recalls, "I thought I was making a decision that was best for me at the time. But after the procedure, I suffered from a severe infection. It was the most pain I've ever experienced, and I spent weeks in the hospital recovering." Similarly, another teenager, Sarah, shares her experience. "I opted for an abortion, thinking it was the solution, but it led to complications that have now affected my fertility. It's a decision that has changed the course of my life, and I have to live with the repercussions every day." These real-life stories underscore the serious physical risks associated with teenage abortion. Complications can lead to immediate health crises, long-term reproductive issues, and even impact a young woman's ability to have children in the future. The physical risks of abortion for teenagers can be severe, with long-term consequences on their reproductive health. It is crucial that teenagers are educated about these risks so they can make informed decisions about their bodies and their futures. Beyond physical risks, teenage abortion also carries significant emotional and psychological risks. We often focus on the physical effects, but we mustn't overlook the emotional toll such a decision can take on a young person's mind. Psychologists highlight that the mental impact of an abortion can be as profound, if not more so, than the physical repercussions. Feelings of guilt, sadness, and regret often follow the procedure, casting a long shadow over the teenager's mental well-being. These feelings can be intense, sometimes leading to severe mental health issues like depression, anxiety, and in extreme cases, suicidal thoughts. Teenagers, still in the process of forming their identities and understanding their emotions, are particularly susceptible to these psychological effects. Some may feel isolated, believing that they can't share their experiences due to societal stigma or fear of judgment. This isolation can exacerbate feelings of guilt and sadness, pushing them further into emotional distress. Yet, it's important to remember that help is available. Counselors and therapists specialize in supporting teenagers dealing with post-abortion trauma. They provide a safe space for these young individuals to express their feelings, navigate their grief, and begin the healing process. One such counselor shares, "We aim to help teenagers understand their emotions and cope with the psychological aftermath of an abortion. It's a challenging journey, but our goal is to guide them towards regaining their self-esteem and finding a path towards healing." In essence, the psychological impact of a teenage abortion can be profound and long-lasting. It's a complex issue that requires compassion, understanding, and professional support to navigate. Recognizing these emotional and psychological risks is the first step towards providing the necessary help and reducing the potential harm to these young individuals. The emotional aftermath of abortion can be overwhelming for teenagers, leading to a range of mental health issues. Therefore, it's crucial that we continue to shed light on this topic, encourage open conversations, and ensure that support is readily available for those who need it. While the situation seems dire, there are alternative options and potential remedies available. We must remember that abortion isn't the only choice when dealing with an unplanned pregnancy. There are other paths to explore, like adoption or foster care. These options allow the baby a chance at life, while giving the teenager an opportunity to continue their education and personal growth without the immediate responsibilities of parenthood. It's also important to mention the role of comprehensive sex education in preventing unplanned pregnancies. Education about contraception and safe sex practices can significantly reduce the number of teen pregnancies, thereby reducing the need for abortions. In cases where a teenager has already undergone an abortion, remedies exist to help them cope with the aftermath. Professional counseling and therapy can offer much-needed support. These services help teenagers process their experiences, navigate their emotions, and ultimately heal. For those feeling isolated, remember there are numerous support groups available, both online and in person. These communities offer a safe space to share experiences and feelings, and to connect with others who have walked a similar path. While it's crucial to work towards preventing teenage pregnancies and abortions, it's equally important to provide support for those who have experienced it. Remember, it's okay to ask for help. Recognizing the challenges and providing the necessary support can go a long way in helping teenagers navigate this difficult phase of their life. Teenage abortion is a complex issue with far-reaching implications. We've delved into its inherent dangers, causes, and the alternative options available. It's crucial to understand that the content shared is sensitive and potentially triggering. The aim is to educate, not to judge. Everyone's situation is unique, and this video seeks to shed light on the matter. Remember, it's essential to have open conversations about these issues. Don't forget to like, share, and subscribe for more informative content like this.